So some patients, though, will be more complex. You're developing a program to assist with this group. Could you give us some background on your plans?
Sure. So part of the program is already in place. The patients who come through the emergency department with AFib and have some complicated issues to their management, they can be referred right from Emerge to the urgent cardiology clinic, and they're generally seen within days as outpatients by cardiologists down in the hospital in our clinic in cardiorespiratory. So that's been in place for a number of months, and so far it's been working very well, and as we add new cardiologists, that's going to grow. For patients who don't come through the emergency department route but who come through family doctors' offices, we are waiting for our new building to open, expected in the spring, and then all the cardiologists will be there. We'll be part of PACE, the group in Newmarket, so we'll be PACE-Barry, and there will be a way to fast-track patients for those where we'll be able to triage them and make sure they're seen in a timely manner as well, not waiting months to be seen, but ideally still days to weeks to be seen. So that should be ready within a matter of 6 months or so.
Okay. So is there anything else you'd like primary care clinicians to know or remember about atrial fibrillation management?
Sure. I think the salient points that we've already addressed are important to remember. Number one, think stroke risk anytime you see patients with AFib. Calculate whether they deserve to be anticoagulated. Number two, remember that these patients should have a new anticoagulant preferred over Coumadin. That's clearly in our guidelines based on the evidence. And number three, keep in mind that we have a lot of resources that are available for patients to have access if they're situations are a little more complicated through the emergency department in urgent cardiology and ultimately through the cardiology group as an outpatient. But for any time that any physician has questions about it, there is a helpful resource through Thrombosis Canada. They have a website available. They also have apps that people can download into their smartphones that can very easily help address some of these questions too in these nuanced cases. So I think that's something that is important for physicians to remember.